So we're going to finish up the lecture that we had today in 320 on shock. The capillary cellular relationship in shock is pretty important. Regardless of the cause or the type of shock present, there's a number of pathophysiological actions that will take place that can lead to the demise of your patient. Capillaries will begin to shut down, resulting in the lack of perfusion to the cells, as well as a reduction in the cardiac preload. Now keep in mind that the preload drops because, again, the capillaries are not allowing the blood return back to the heart. Preload is defined as the volume of blood that's returned to the heart. So when preload drops, cardiac output will drop as well. When capillaries block off the blood from coming through, then it will reduce the preload as well. Left unchanged, anaerobic metabolism begins to occur, resulting in an increase in lactic acid with the occurrence of metabolic acidosis. Precapillary sphincters, or tiny little openings just before the capillaries, will cause the capillaries to become engorged with blood that leads to the clumping of red blood cells, or the clotting of red blood cells. A condition known as disseminated intravascular coagulation, or DIC, occurs in which remote blood clots throughout the body begin to occur. Because of this condition, again commonly called DIC, uses up the body's clotting factors, your patient may begin to hemorrhage in other parts of the body while they've got massive clot formation in still other parts of the body. Pulmonary edema, respiratory failure, and acute respiratory distress syndrome begin to develop. At this point, your patient's pretty much in an irreversible shock. The kidneys and liver begin to fail, and death follows shortly thereafter. As we discussed, fluids can have a negative effect on the formation of clots within the body. Being really aggressive with the administration of IV fluids can also cause more problems than what they are as far as being beneficial. If you give a large volume of IV fluids, most commonly given crystalloids, the patient's blood pressure will begin to increase. This leads to increased pressure on the clot, as well as an increase in the rate of bleeding. Keep in mind that when you give a massive amount of IV solution, the clotting factors that are necessary for the bleeding to stop are then diluted, and the platelets also become less sticky. Fluids do not carry oxygen, and a large amount of fluid reduces the ability of your hemoglobin to even carry what oxygen they're able to do. So that's why we want to be judicious with the amount of fluid that we are administering to our trauma patient. Your goal should be, as far as fluid resuscitation, to maintain a blood pressure of between 90 and 100 and no higher. The maintaining of your patient's body temperature is imperative, as we've discussed over and over and over, towards the formation and stability of clotting during trauma. Your patient is hypothermic. Clotting factors do not work nearly as well, leading to ineffective hemostasis, also known as blood clotting. As we conclude this, hemorrhage is a significant threat to the well-being of your patient and can lead to life-threatening shock. With the increase of shootings, particularly those in a mass setting, it's important for you as the paramedic to be able to understand what is happening at the cellular level so as to come up with a workable care plan when everything that you're doing is not effective. Keep in mind that the signs and symptoms of shock can be mistaken for simply a patient who is excited or anxious after a traumatic event. Don't get caught blindsided. Rapid assessment and necessary treatment are the same with quick transport to an appropriate trauma center that has surgical capabilities is the best chance of survival for your patient.